Are you caring for someone who is disabled or an elderly person? Someone in need of a physician? Is it difficult to transport that person to the doctor's office? Well, today there's an option to have the doctor come to you. And it's a service called Visiting Physician. Dr. John Salisbury is founder of Visiting Physician Services, headquartered in Eatontown, New Jersey. And here to tell us about his services is Alex Binder, Chief Operating Officer. Welcome, Alex.
Hello.
So I have a parent living with me, and they use a walker. It's hard for them to get out of the house. What kind of service does Visiting Physician provide?
Right. Well, essentially, Visiting Physician becomes the patient's primary care physician. We would provide all the necessary services. We will assess the patient. We'll do a physical exam on the patient. We'll diagnose and treat that patient. So we become the primary care provider for those people who are elderly and homebound and can't really get out anymore.
Now, what kind of services, specifically some of the services you say that you provide?
Well, our physicians and nurse practitioners and physician assistants would do everything that a typical family practice physician would do. We can draw blood in the home, but beyond that, we also partner with a number of allied healthcare professional organizations. We can have x-rays done in the house. We can have an ultrasound done in the house if they're looking for a blood clot. We can get oxygen in the house. We can get durable medical equipment. Some people need wheelchairs. They need a commode. They need a hospital bed. So we have knowledge of all of these resources that are out there in the community. If they need visiting nurse services for wound care or diabetic management, all of those types of ancillary services, we can coordinate that as well.
Now, what is the, as far as the visiting physician goes, what is the actual cost? Is that covered by the patient's insurance or what?
Right. We take Medicare, traditional Medicare Part B, and we are a participating Medicare provider, and we accept Medicare assignment. And what all of that means is that Medicare sets our fees, and then Medicare will pay us 80% of that fee. The other 20% is the patient's responsibility. In the majority of cases, they have a supplemental or Medigap policy, and we will accept any form of Medigap. So in many cases, the other 20% is also covered by an insurance.
Now, as far as that cost goes, are you comparatively the same as going to the doctor's office, or is it basically more expensive generally?
Medicare does pay a slight premium for home visits, but candidly, it doesn't make up for the impact that it has on our efficiency or the volume of patients that we're able to see. So yes, there is a higher fee paid for a home visit than an office-based visit.
Now, aside from the obvious convenience of the doctor coming to the home for the patient, what are some of the other benefits that would be to the patient as far as the doctor coming in there
Right.
and treating them for a specific ailment or illness?
Right. Well, what we find is that, this type of situation where the physician goes into the patient's environment is much more advantageous for us to understand all the impacts and environmental impacts that that patient is going to have. So are there safety issues in the home? Is there a carpet that's unraveling that they could potentially trip and fall on? Are there nutritional issues? So we can look around the house and find out, are they eating regularly? What is it that they're eating? And more importantly, we can assess family dynamics. We can determine if there's a caregiver involved in the case. And our physicians do a pretty extensive job to try to understand their medical background and history. So they're going to ask the patient, please bring me all of your prescriptions from the medicine cabinet. We're going to look at the bottle and we're going to say, it's the end of the month and this bottle's still half full. Why haven't you been taking your medication? So they're going to have insight into the real world that this patient functions and lives in, and then they're going to be able to devise and develop a treatment plan that's going to work for that patient in their particular scenario.
Okay, and as far as the time spent, you mentioned, seeing the environment and talking to the patient.
Right.
What's the average time of a visit from your service?
Well, a new patient, the physician is going to be out there for 40 minutes to an hour in most cases. They're going to do a complete assessment, physical exam, they're going to take a history, they're going to hopefully be able to talk to a caregiver who's going to be involved in the case, and then they're going to be able to put together some type of treatment plan. That takes time. They will also coordinate any of this other activity that I had talked about earlier. So all that is going to be accomplished during this first visit. Once a patient is established with us, we're familiar with them, we're familiar with the diseases that they have and the conditions that they have, it's probably a 15 to 20 minute visit. But keep in mind, that's FaceTime, okay? That's face-to-face with the clinician. When you typically go to a office-based practice, you spend time in the waiting room, time in the exam room, the nurse does your blood pressure. All of that is done face-to-face with us, with our clinician in your home.
And you mentioned going to a doctor's office. I know a lot of times you have to wait hours before you get in. What's, as far as the time element, are the visiting physicians, if they say we'll be there at 10 o'clock, 10:30, are they pretty prompt when it comes to that?
Yes, we survey, we do patient satisfaction surveys. We ask the patients, because it's hard for us to monitor exactly what's going on, but we do ask them, was the physician prompt, was the nurse practitioner there on time? We give the patients typically a 2-hour window. So we'll say the physician will be there between 12 and 2. That way it gives us some leeway if the previous patient was more complicated than expected, if there was a traffic nightmare, if there were weather conditions, whatever it is. So we do work within that time frame, but we try to be as prompt as possible.
Now, what percentage of your patients would you say are elderly?
The vast majority, over 95% of them are elderly. The other 5% are younger patients with typically neurological diseases, MS, ALS, other type of brain injury, some quadriplegics and so on. But over 95% are geriatric patients.
Besides going in the home, does the visiting physician go to a nursing home or an assisted living if you're called?
We go to senior housing facilities, private residences, and assisted living facilities. Typically, we won't go to a nursing home. Those are sort of contained facilities with their own staff and their own physicians. So we try to stick to some of the markets that don't have those sort of built-in staffs.
Now, as far as your staff goes, what kind of background do your physicians have, and how do you find physicians that are willing to make house calls today?
Well, the background, a lot of it stems from Dr. Salzberg, who started this practice over 15 years ago. He has been out in the field treating patients in their home. Typically, they're geriatric patients. So he really is an expert in that area, and he helps to teach and train all of our other clinicians. But we make sure that our other physicians and nurse practitioners and physician assistants come with a tremendous amount of experience, that they're familiar with the elderly population, that they're familiar with geriatric care. We have recently hired a gerontologist, so he brings a tremendous amount of current knowledge and information to the practice as well.
Now, what areas do you service the visiting physician?
Well, geographically, we cover, I'd say, 5.5 counties. We cover Ocean, Monmouth, Middlesex, Union and Essex counties, and part of Somerset.
Okay. Now, with the continued aging of the baby boomers,
Right.
And your practice is obviously growing,
Mm-hmm.
do you see the visiting physician will become more commonplace?
Well, we hope that it will be. We've only seen minimal growth with this type of practice. not ourselves, but other physicians who are getting involved in this type of model, this type of delivery model. But the reason for that is that there's a number of reasons. One is it's difficult to make money doing this, and number two, physicians go to medical school and they sort of have a dream, and the dream is to have their own practice and have their own office, and it's very different. Our physicians are putting on their raincoats and going out and sloshing through the mud, and maybe a lot of people didn't sign up for that. So we haven't seen the response to this demand as you would expect.
So is there a demand from the consumer end and not enough physicians willing to go out to do this kind of service, would you say?
I'd say yes, and that's only going to get more intense. If you look at the demographics, the aging baby boomers, people are living longer. People are living longer with multiple chronic conditions. They need support and help. And when they can't get out anymore, when they're 80 plus years old, 90 plus years old, and they can barely walk anymore, that type of demographic is only going to grow. And that type of patient is only going to become more in demand.
Now, aside from health insurance that you mentioned, do you see the government or the state in any way getting involved in funding this kind of service?
Well, we're always hopeful that somebody within government, will realize the value, the economic value of what we provide. Just to explain a little bit, about 5% of the Medicare population incur 50% of the healthcare expenditures, okay? And what is happening is that the majority of this money being spent occurs in the last 2 years of life. So you have this small segment of the Medicare population that is using a lot of resources within the system. And what are those resources? They're seeing a number of physicians, they're seeing a number of specialists, they are going into the hospital, tests are being done, diagnostic procedures, other type of procedures are being done. So a lot happens in these last 2 years of life. But if you were to talk to these patients who probably had a 2-year life expectancy, and you said, what would you like the last 2 years of your life to look like? They would typically say, I'd like it to be peaceful, I'd like to stay home, I'd like to be with my family. And the reality is that from the patient's perspective, in the majority of cases, that doesn't happen. And from the healthcare system's perspective, it's not an inexpensive process. It's a fragmented process. There are a number of resources that are utilized. And, if we could try to get that all in alignment between what the patient wants and what the healthcare system can provide, we think that we provide that here. We really do. We think that we have that solution that, not just us, but a physician who goes out to the home and takes care of these patients that are in these last 2 or 3 years of life, could help everybody. And hopefully, if that were recognized by the government, and they would realize that there is this tremendous benefit to the patient and to the economic system as well, that they would, somehow try to provide a better premium to the type of practices that do this type of work.
Now, how does someone get in touch with you if they want to have a visiting physician come to their home?
We say the best way to get in touch with us is just give us a call. Our number is 732-571-1000. If you just had a question, if you wanted to arrange an appointment, if you're calling on behalf of someone else, whatever it is, our receptionists are very knowledgeable and helpful. They're good resources. So, I would say just to call our number is the best way to get a hold of us.
And what is your website?
Our website is www.visiting-physician, and physician is singular, .com.